Stuart often spoke with so much pride about his daughters, and we can clearly see why as they make their way to the stage. Taelor has worked in media production and research since graduating from Barnard College in 2019, where she majored in anthropology and photography. And she explored her interest in combining ethnography, is that right? I want to say ethnography, but there's no other O in there. That would have been messed up. Ethnography and visual art to enhance storytelling and visual language. Taelor has written and directed 3 short films and placed in the top 3 at the Martha's Vineyard African American Film Festival. And that was really cool. The picture we saw earlier, that was like the last time that you were the taller one, right?
She's still bitter about it. So.
I know, right? I know. Now, Sydney is a senior at Columbia University here in New York City. She's majoring in political science with concentrations in American politics, comparative politics, and minoring in African American studies. When do you have time to compete for the women's track and field team and singing in the university's a cappella group? When do you have time for all of that stuff? Sydney also has a passion for social justice, which was ignited when she won the Princeton Prize in Race Relations as head of diversity for Miss Porter's School. And Google the Amendment Project for her latest endeavor with a certain tall-haired young fella that's sitting over there that happens to be my son. Oh, Sydney, wait. Can I tell him? Can I tell him about the Rhodes Scholar sort of thing? Can I tell him? Can I tell him you're going to Oxford and studying Oxford? Yeah. Yeah, that's, when do you have time? Ladies and gentlemen, we are pleased to have here tonight Taelor and Sydni Scott.
Yeah. Good evening. Our dad was so much more than the super exciting guy you saw on SportsCenter every night. He was and will always be our biggest hero. We celebrate his life tonight and all that he stood for, and we will continue to fundraise to continue his fight against cancer and cancer disparities. The V Foundation has funded nearly $15 million through the fund in my father's name, and we are so grateful we can't say. Those dollars are funding the researchers who are committed to stopping inequalities in cancer outcomes. It's also funding Black and other minority researchers, giving a louder voice to communities from whom we have not heard enough in the cancer space.
Tonight, in just a few minutes, we will hear from 2 incredible researchers who are funded through the Stuart Scott Fund. We'll learn more about their efforts to stop cancer. Dr. Jasmine McDonald joins us from Columbia University, a fellow Lion, where she is investigating postpartum breast biology in order to determine and identify the mechanisms behind postpartum breast cancer. She's a graduate of the University of Maryland, and she received her Ph.D. from Harvard University. And we are also joined by Dr. Melody Smith from Stanford University, where she is researching ways to improve donor stem cell transplants to decrease cancer relapse and reduce or eliminate side effects.
These researchers are learning more about cancer and how to stop it. We are so excited to see what their studies uncover, and we so applaud them for their dedication to achieving victory over cancer.
It is just an absolute honor to welcome Dr. McDonald and Dr. Smith. Honestly, I will add this as the last thing. As you heard, my sister studies film, I study political science. My mom really wanted a doctor. And so it is just so incredible and so inspiring to see these 2 researchers as incredible researchers, as Black women to look up to, for women who are interested in pursuing these kinds of challenges and rectifying these kinds of inequities. So it is just my absolute honor to introduce the 2 of them tonight. Thank you so much.
We talk a lot about health disparities in the minority community. Why do those exist?
There's many reasons why health disparities exist, and in my avenue of public health, I'm an assistant professor at Columbia University. We talk about the inequities as it relates to social factors. So it's the air we breathe. Based off of what Bristol Myers Squibb said, yeah, your area code really matters. Do you have access to healthy food? Do you have the safety to walk in your neighborhood? Do you have the air quality where you're not living near a garbage disposal? Like, health disparities exist because of social determinants that can be remedied.
In addition to that, those social determinants also impact when patients present for care. So oftentimes those disparities further heighten the impact of cancer on minority populations because they present later, perhaps because of their insurance or lack of insurance access, aren't able to get access to the cutting edge therapies. And so these are all issues that need to be rectified.
Where does your fire to fight this come from?
So my fire to really fight this really comes from a very early age. So I grew up in East Texas, and I remember at a young age just vividly family friends who were diagnosed with cancer, and my parents would tell us about this, and then it just seemed, at least in my mind's eye, that those people would pass away shortly thereafter. And so then in my science classes, as I went through high school, college, I really was intrigued by the way that cancer develops, the way that a cancer cell develops and then can, cause havoc on someone's body. And so that was something that I was pretty sure that I wanted to pursue even as an undergraduate. But the real landmark incident for me was when I graduated college. There was one of our family friends who had pancreatic cancer. And by that point, he was on inpatient hospice. And my parents had me and my sister both go sit in with him in the inpatient hospice to provide respite for his wife. And he told me, your mom and dad told me that you want to be an oncologist. And I was like, yeah, I want to be an oncologist, And I was really excited about it, but he helped to humanize it for me because it's somebody that I knew for a very long time. And at that point, he was in his latter stages of life. And he said to me, Melody, if you want to be an oncologist, patients need someone who is going to be empathetic with them. And I want you to maintain that empathy. And so really, as I pursue my research and as I interact with patients, that really drives me, making sure that I'm passionate about my research, doing things that are going to advance the field, improve outcomes for patients, while also being empathetic and compassionate.
What about you, Jasmine?
So for me, it was the birth of my son. So I'm very interested in postpartum breast cancer. And so 6 years ago when I had my son, as a breast cancer researcher, I knew all of my personal risk factors for developing breast cancer. But as a Black woman, I also knew my likelihood of being diagnosed with aggressive breast cancer, like triple negative breast cancer, my likelihood of having the breast tumor spread outside of my breast or metastasize, and the likelihood of me dying was much higher. And so I was scared, and I remain very scared, but the fear really assaulted me when my friend of like nearly 20 years called me almost a year ago to the date on my birthday that she was diagnosed with triple negative breast cancer, and her son was 6 years old. And so soon after she called me, I was awarded the V Foundation to do this work. So it's destiny.
That's amazing.
What is it about the V Foundation's research program that you said it was destiny, but that keeps it going every day?
For me, it's a challenge to do health disparities research in the United States. And I feel that the Stuart Scott Memorial Fund changes the game for me, for the research community, for future researchers. I see it as, my dad would say, like stiff arming all the naysayers,
right.
Because I've been told, you wanting to do health disparities is very disadvantageous for your career. I've been told that, You know, your institution may need to change because an Ivy League institution isn't going to support you as a Black investigator. I've been on research committee for funding mechanisms where they've said, oh, it's not important to study chronic disease in women only. Or, oh my gosh, they're only studying a Black population. Where's the white comparison group? And so this is something that's told wide span. And the Stewart Memorial Fund provides the opportunity for researchers like me to be able to pursue these health disparity issues within disadvantaged groups, within groups that are disproportionately affected. It allows us to stand up and say, there's a mission, there's an investment in this, and it provides the opportunity for me to actually fulfill my own mission.
Okay. Melody, what about you?
You know, somebody up here mentioned teamwork, and I think when we think about sports, there's a lot of team momentum, and we can all picture that when we think about sports, but really medicine and science is team. It's a team science, it's team medicine, and in order for us to be successful, we have to have our research teams. So I just moved from Memorial Sloan Kettering Cancer Center to Stanford to start my own research lab, and I have to work with a team and lead that team to advance the work. And I think that the beautiful thing about the V Foundation is you really feel that community and support of the team, not only from the foundation, the funding, and the work that's being done, but also by being able to interact with investigators from all over the country, many of whom are from underrepresented backgrounds, or many of whom are also investigating cancer disparities. And there's that opportunity for collaboration, maybe collaborations that wouldn't have happened otherwise. So I think that's one of the beautiful things about the V Foundation, in addition to the fact that one of the main sources of funding for research is the government. But really that's not enough to fund innovative science, early career and early stage science. So foundations like the V Foundation are so instrumental and important to help to get that research off the ground for early investigators or work that's high risk but has a potential for high reward in the future.
Piggyback off of that for a second, because we have a lot of donors in the audience. What would you say to them as they listen to you talk about the importance of tonight?
I would say that we're just two of the people that are funded, so I would highly encourage all of you to look at the website. You can see a little bit of information about the various other investigators, but I know that me, as someone who just started my independent research lab 3 months ago, I'm at the very early stages as an assistant professor at Stanford. I need funding from all types of sources, not just the government, not just one foundation, but many, to really fuel the work and to get it to the point where it can be in clinical trials and can then potentially be licensed for new patient therapeutics. And I'll say that as a scientist, you asked about my passion. I think the other thing that really drives me is I see patients every day. I see what they go through. I see the impact that cancer, the diagnosis of cancer has on a family, on children, on parents, and knowing that I can go back to the lab and drive the ball forward, advance treatments for patients, and come up with better therapeutics, I think that really drives me. And organizations supporting this work is so, I feel very humbled and very honored to just have this support, even from donors and the V Foundation.
I would say, you know, I would have like two main messages.
All right.
The first would be that, you know, cancer is not fought just today. There are many who have fought yesterday. There are many that are fighting today, including me and Melody. But really, it's those also who are aspiring to fight. And what your contribution does is provide the opportunity for those who are aspiring to get into this fight to do so, and to do it for health equity. The second thing is that, you know, your investment pays in dividends. Like Melody said, we're just two researchers here, and you're helping us provide care and provide research that helps health disparities. But really what you're investing in is the lived life of an individual faced with cancer. You're investing in generations. You're investing in the ability of someone diagnosed with cancer to have more time with their children, with their family, with their friends, with their colleagues, with their community. That's what you're investing in. And I think Mr. Stuart Scott really knew this. I mean, Mr. Stuart Scott was a friend. He was a colleague, a brother, a father. And he would probably ask us all here, you know, how are we living? And so in my mind, it's imperative that investors understand that you're providing an investment for the long haul so that those faced with cancer continue to live their lived life in a respectful, loving, and meaningful way.
Brilliant. Both of you. Brilliant. Brilliant.
Can I piggyback?
Yeah, go ahead. Yeah, Melanie. Yeah.
I want to piggyback on the first point that Jasmine made, because I think that's a really important point to highlight further, is cancer disparities. And you all mentioned it at the introduction, that there's a disparity in cancer research because of, you know, disparities in cancer care, but also there's a disparity in cancer researchers, right? That oftentimes people investigate and pursue what they're passionate about, and by funding investigators from underrepresented backgrounds, we're going to help also with the pipeline to bring other people along who we can mentor from underrepresented backgrounds, but also investigate those issues that may more likely impact our community.
Wow. That's good stuff. Doctors Jasmine McDonald and Melanie Smith, give them a big round of applause. Thank you both.
Thank you.
Thank you very much.
Fantastic. Stand on your feet, please. With researchers and doctors like these, I think the future is super bright. Thank you. Thanks for that, Jay. Amazing.